Hi there, my name is Courtney. I am a PA. I've been practicing for the past 10 years. I founded empoweredpas.com, which just started as a blog and has really morphed into a resource for PAs, pre-PAs, and PA students to learn more about the profession and learn about opportunities that exist out there for practicing PAs especially. It's one of the things I love to talk about. It's kind of the thing I'm really passionate about. In fact, we've got a lot of articles already up there about that. But my friend Michelle and I, she has an article up, you should definitely take a look at that. She's an MSL. We were talking and she had a great idea, which is that we should put a little video together showing you guys what the different roles PAs can hold in a non-clinical setting. And so that can be a wide variety of things. But I want to share that with you. Thank you to Michelle for putting this together. I'll talk about my role in a minute, but just wanted to introduce you to what we're going to be talking about.
Hi, my name is Vicki Pittman. I am an ER and an urgent care PA and a senior medical editor at Hippo Education. And I'm going to take a couple minutes just to talk about my non-clinical role as a PA and also to give some advice to people who are looking to move into this space. I'll talk a little bit about how I landed the role that I'm at currently. I was first introduced to Hippo Education in 2013 when I used their PANCE Pan Read board review course to study for my boards. And I'm sure, as you can all remember, studying for your PANCE comes at a time that is incredibly stressful, to say the least. So you're either about to graduate or have already graduated. You are trying to land a job, all the while trying to study for this really high stakes exam. So I was really delighted to find a board review product that would help me retain that information and really just did such a wonderful job of distilling the information in a way that was easy to remember and also incredibly enjoyable. The videos were so funny, they were entertaining to watch. So I absolutely loved the product. I fell in love with the company after I passed my boards and started working in the ER. I was following them on Facebook, and 4 years later in 2017, they posted a job for an assistant medical editor, and I applied and I got the job. So I started working for them on a part-time basis as an assistant medical editor in January of 2018. I started off working in their pediatric and ER product lines, primarily doing some content generation for their video courses and their question banks, among some other things as well. And since then, my role has transitioned. So now I am currently the head or sort of overseer of the pediatric products at Hippo Education. We have a podcast called Peds Wrap, board review, and question bank courses. And so I manage teams of clinicians that help create the content for all of those products, the products that we have currently, as well as products that we have kind of coming down the pipeline. In addition to that, I collaborate with our other teams at Hippo Education. I collaborate with our sales and marketing teams. I collaborate with our customer support teams and product, just to make sure that we are meeting the needs of the pediatric clinicians that purchase our products. And then in addition to that, and probably the most fun thing that I do at Hippo Education, the thing I enjoy the most, is some strategic thinking and planning around our pediatric product line and where we need to go next, what opportunities that we need to move into. So that's really, really fun. I absolutely love working for the company. Our mission at Hippo Education is to help clinicians learn, grow, and thrive. And everything we do on a day-to-day basis is in service of that mission. And so it's really inspiring to be around people who and all of the different teams are really working and striving towards that. I love working for the company and specifically my boss, who has really helped me grow in my role at Hippo and also is always looking for opportunities for me to expand my influence at Hippo Education. I feel incredibly supported. As you can imagine, nothing that I do on a day-to-day basis is anything that I learned in PA school. And so I feel incredibly supported in them helping me attain and maintain the skills that I need to do well at my job, which is really, really fantastic. We are a remote company, so most people work remotely. We are headquartered in Los Angeles. We have a studio there, but most of my colleagues are remote. And while there are some definite advantages to working remotely and working from home, that's probably the thing that was the hardest transition for me, going from full-time clinical work to full-time medical education from home. So you miss, or at least I miss, the face-to-face sort of regular interaction with my patients, If you do other forms of education, you have more regular face-to-face interaction with students. But we have a really strong remote culture nonetheless at Hippo. We have a messaging platform that we use. So I'm constantly on Slack talking to my coworkers. We also do video calls and that kind of stuff. And then during non-pandemic years, we do retreats and get-togethers and that sort of thing. So we find a way to have a really strong culture, even though we're all remote. My advice for people that are looking to move into this space would be to just keep your eyes and ears out for different opportunities to work on projects with medical education companies. I mentioned that I found the job through a Facebook post, and I will tell you that for many of the projects that I sort of spearhead and some of the teams that I manage, I get clinicians and recruit them from Facebook, from different PA Facebook groups that I'm a part of. I'll put a call out for people who might be interested with a job posting and see who is interested. And it's a really great way for us to get to know different clinicians who are interested in medical education and for you guys to get to know us at Hippo Education. It has been a way for us to grow our teams at Hippo Education. And I would say most of the people now that work underneath me that are either employees or regular contributors are people who have done one-off projects with us that we have found through avenues like Facebook or other different job postings. So just keep your eyes and ears out for different postings or different sort of call outs on Facebook or other different social media platforms. I think that's a great way to get started. If you have any questions, feel free to reach out to me. I'm on Facebook, or you can email me at vicky@hippoeducation.com if you have any questions. Thanks so much.
Hi there. So my name is Courtney. I'm a pediatric emergency medicine PA. I also work in patient safety and quality as the clinical pathways program coordinator. So I love talking about my non-clinical role because I think it's really important for PAs to consider administrative or non-clinical roles in their kind of repertoire. What I do, what that means is that I currently help organize our multidisciplinary teams and the creation, development, implementation of our clinical pathways. Clinical pathways are evidence-based documents that we use to kind of guide our care based on our current workflows and also evidence-based practice. And so an example of that would be like croup or sickle cell, where a patient presents to a certain department with a certain disease concern or process, and our hospital has a kind of a workflow that we usually follow, but also there's some evidence to support that. And so these documents, there's many of them in pediatrics, and these documents, our hospital didn't have one when I started. I started working on them and wanted to develop a program. So on a day-to-day basis, what that means is that I help teams. It can be nursing teams, it can be physician teams in different institutions or different specialties. So like a surgery group or, the nursing team in the ER says, hey, we think this would be a really great pathway. We have meetings to discuss that. And then we start developing a document. I send them templates. I kind of work them through the process. They will present their pathway, or I'm involved. I've done many of them myself. We will present them to our clinical practice council, and then it will get implemented in, order sets and education and things like that. And so that's kind of the nutshell. What also has happened is that I've been allowed to do things like quality improvement projects, research projects, and there's been more that's kind of developed out of my role as the clinical pathways program coordinator, which has been amazing. And I have a lot of opportunities. So I guess when you think about the pros and the cons, the pros of the position is that I have a lot of flexibility. And so I get to schedule my days and my meetings, and everybody has to be flexible because I still work in the ER, which means nights, weekends, and holidays. And so one of the pros is that I really get to make my own schedule. With that said, one of the cons is that sometimes meetings happen and I have to wake up from a night shift and go to that meeting. And that's kind of a challenge. People are pretty understanding, but sometimes it can be one of those, the expectation is that I have to be there. Also, there's, from a con standpoint, I really have to make sure I set some of my own boundaries of no, I need to have one day off during the week for X, Y, and Z reasons, and set a boundary. And that's been a little challenging, but overall, I would say it's very much a positive experience. I'm very fortunate and thankful for amazing mentors who have helped kind of educate me and teach me in the ways of, being in hospital meetings with higher ups and, the C-suite level kind of meetings, and That's been its own education in itself. It's very different than taking care of patients clinically. What I love about it though is that we really do get to make changes in clinical outcomes. So for example, we implemented a febrile neonate pathway, which so if a baby under 28 days comes in with a fever, we have a plan, and it's a plan for our department specifically. And so we are able to get like the lumbar puncture done soon, quickly, and get antibiotics in quickly. And part of that plan has allowed us to get time to therapeutics down quite a bit. And so like we're able to improve our clinical outcomes, meaning babies do better when they get antibiotics sooner. We know we can do that because we've improved and streamlined the workflow, reduced the waste, kind of identified gaps, things like that. So process improvement is definitely my wheelhouse, but it wasn't when I started. And so I kind of want to throw out there that if you're ever thinking about a non-clinical role, kind of look around and see what's out there. I really love evidence-based practice and wanted to find a way to make it easy for providers. And so that is how I kind of got involved. But you have to ask around and ask people, you know, what's out there? What are people doing? And for me, that was kind of how I got started. And that's a whole nother story for another video, but I hope that helps. And I'm glad to talk about it more if you have more questions.
Hi, my name is Janelle Bludorn, and I am an assistant professor at the Duke University PA program. And I'm going to be talking to you a little bit about what PA faculty members do, as well as some of the pros and cons of working in academia as a PA. So all of us that are watching, or pretty much all of us that are watching here right now, either went to PA school or are currently in PA school or want to go to PA school. And so you probably have a little bit of a sense of an idea of what a PA school professor is and what we do. The two big things that come to mind are teaching and advising. And those really are pretty large portions of what I do as a faculty member in a PA program. So a lot of times you think kind of about the stereotypical teaching of doing like a lecture in a lecture hall or teaching at a lab. And those are some things that are very common that I do in terms of my role as a faculty member. Another thing would be advising, and this may be one-on-one advising with assigned academic advisees from a particular cohort, or maybe more interest-specific or kind of career-focused specific advising. And so I am an emergency medicine PA by work history and training, and so a lot of my more like one-on-one or group advising has to do with people that want to pursue emergency medicine in the future. So that's kind of like the teaching and advising pieces of it. However, there's a lot more that we do as faculty members in PA programs. So the first part that I want to talk about, something that you may not think of right away, is this idea of like directorship or coordination of courses or units. And so essentially what this is curricular design, organization, recruitment and retention of guest lecturers to essentially make sure that what we're teaching is the most up-to-date, that it's organized, that it's presented in a logical manner, it's presented by the right personnel, and it's engaging. And so essentially this is just kind of like the background work, that all the stuff that goes into those lectures and labs that kind of represent what you think of for teaching. And I like to make sure that people kind of understand that when it comes to teaching, every 1 hour that you are in that lecture hall or you're teaching in that lab, there's almost always about 2 hours of kind of this like coordination or curricular design or kind of organizational work that goes into that beforehand. So that there's a lot of this like background work that goes into it. The next thing that I want to talk about is this idea of pursuing scholarship. And so this might look different for different people. It may include things like having your own independent research, writing for like journal articles or blog posts or things like that. Non-traditional scholarship like, having webinars or podcasts, doing other traditional scholarship like giving grand rounds or presenting at conferences. And so this idea of scholarship is essentially where somebody adds to the body of knowledge in, say, like medicine or medical education, and then communicates that either verbally at like a conference presentation or in written work, like for journal articles or other online media. The next thing I want to talk about is administrative tasks. And so this includes things like committee work at like a program level, departmental level, or even kind of like external to your institution level, as well as like admissions, and then making sure that you're aligned with accreditation standards. So this part might sound a little bit boring, and maybe it kind of is, but it's very, very important because this is the type of stuff that helps keep a PA program going. The last thing I want to talk about is clinical work, because although we're kind of focusing on non-clinical roles for PAs right now, most PA faculty members do maintain at least like 0.2 to 0.3 FTE, or 20 to 30% of their time in clinical work. And so I am personally taking about a 1-year hiatus from clinical work in emergency medicine, but that is something that I will go back to, and I really do love doing clinical work, even though I am primarily a medical educator. So let's talk a little bit about pros and cons of working in academia as a PA. First and foremost, I think that the biggest pro is that you are teaching. And as a teacher, you really get to have impactful effects on the future of our profession by essentially, planting seeds of knowledge in future PAs' brains. And I think that that is just one of the coolest and best and, awesome, most awesome things you can do. And so I love teaching. The con about that, though, is that it's not all teaching all the time. And so that administrative stuff that I talked about, that coordination and organization type of stuff that I talked about, that does take up a lot of your time. And it's not always the, fun of teaching in a lab or kind of like the excitement of being up in front of a lecture hall. But all these things are really important and really kind of feed forward into the quality of education that you do. And so just realize that it's not teaching all the time, but all these other parts are really important. The next pro is that it's not shift work. There is a little bit more flexibility in terms of when you work, where you work. You get to kind of make your own hours and do what you want to do kind of on the timeline that you want to do it within reason. The con that's related to that is that it's not shift work. Coming from emergency medicine, I did that before I worked in academia. I would go to work, I would do a really intense thing for 10 or 12 hours, and then I would finish my charts, go home and forget about it, and really compartmentalize my life. When I'm teaching or as a faculty member, my work oftentimes follows me home, and it's sometimes difficult to know when to stop checking emails or how to draw boundaries between my work life and my non-work life. And so that is one of the cons of the fact that it's not shift work. The next pro that I want to talk about is that you still do have the opportunity to do some clinical work. And I think it's very important that you do continue to do some clinical work just to maintain those skills and stay sharp. However, a con may be that you don't get to work clinically as much or as frequently as you want to. Like I said, usually about 20 to 30% of your time is spent working clinically. And if you're somebody that really loves seeing patients, that may not be enough time to give you some fulfillment. And then the last thing I want to talk about is the fact that when you are a faculty member, you really are forced to stay up to date on pretty much everything. I feel like I'm, reading updates and learning more and doing that so I can be the best teacher possible all the time. There's a saying that says that if you want to know something very, very well, you should learn how to teach it. And I absolutely agree with that statement. I think that the flip side con with this is that sometimes you are expected to teach things that might be a little bit outside of your comfort zone. For example, I'm an emergency medicine PA, but I am expected to teach some things through the lens of primary care because PAs are trained as generalists. And so that it's not necessarily a negative. It just sometimes takes a little bit more relearning, reteaching, and kind of mental energy in order to be able to teach those things. And so I hope that this was useful. I hope I gave you some pretty honest and open pros, cons, as well as details of what it's like to be an academic PA.
Hi, my name is Abby Jacobson. I am a physician assistant working as a medical director in a mid-sized pharmaceutical company, and I was asked to record this video to tell you a little bit about my job as a medical director and how I came into this role. So it's actually hard to summarize my job in just a couple minutes because just like being a PA, there's a lot of different aspects to my job. It's actually one of the reasons I love it, that no 2 days or no 2 hours are the same. It can constantly be different. And the other thing that makes it a little bit hard to describe is there's a lot of differences between different medical director jobs, particularly based on the size of the company. So there's medical directors that work in clinical operations, there's medical directors that work in research and development, R&D, and then there's medical directors that strictly work in medical affairs. And depending on the size of the company, they may have different duties. So with that in mind, I'm going to give you some broad, general answers about what a medical director would do for a pharmaceutical company. And then I'll give you some specifics about what I do for my job specifically. So a medical director will work on the life cycle of a medication. So what does that mean? That means a medication that is just starting to be tested, right? That could be early in the lab all the way to first studies in patients and humans, to then the different phases of studies that are required for FDA approval, to then approval, then studies that happen after approval. And then as medicines kind of go through their life, right, then generics and competitors may come on the market. And there's different pieces of information that you need through that whole cycle in order to support that medication. Now, a medical director and anyone working in medical affairs, whether it's the medical director or medical science liaison, you're supporting that medicine from a scientific point of view, not a sales or marketing point of view. You're supporting it in terms of publications, thought leaders, clinicians, research. You're not supporting it in terms of, sales or numbers of prescriptions. That would actually be a violation of the pharma regulations. So a medical director is really looking at that from a global view and looking at what that strategy needs to be. So that strategy is going to involve things like publications. And so for my role here, and most medical directors do get involved in publications, directing them, writing them. I have medical writers that work under my direction, choosing authors, choosing certain content, what data and what data cuts are going to be run from my data team, my statisticians that go into certain publications and when they're going to come out, right? If a medication is new to launch, right, brand new, we're going to go with basic efficacy and safety data. But if a medicine has been out for a little while, right, we might look at it in a subpopulation or a niche or an area of need, okay? The other thing is that a medical director will do is they'll support other teams internally within the company. So things like interacting or developing pieces or messaging for the medical science liaison sometimes, interacting with the safety department called Pharmacovigilance. That's a whole separate department that every pharmaceutical company needs to have. And I engage with our safety department on a regular basis, whether that's reports that have to go to the FDA or reports that come in that we have to make some decisions if we're going to change anything. I work with our regulatory department. Those are the folks who deal with the FDA and language of our package insert. I work with our medical information department. That is some of the folks that if you were to submit a medical inquiry and you get a letter back, they're drafting much of that. And then some of the sales and marketing team to support their training about our medications, but also in terms of disease state. And then externally, I will deal with thought leaders, physicians, nurse practitioners, PAs that are experts in their field. Typically, if they're dealing with the medical director, they're what's called like a top tier thought leader, someone who's a national thought leader or an international thought leader, so that I can get their insights, invite them onto publications or an advisory board. And I'll periodically have advisory boards where I'll bring in thought leaders and get their opinion. The other thing that I will do as a medical director at my company, some companies have medical directors who do it, some have specific medical directors who do this, is I will look at what our upcoming medications are, whether that's a medication we're developing from the lab or one that we're purchasing. So actually, I've been super busy looking at a medication that we're thinking about purchasing from another company in another country. that they've developed a medication and they only want to launch it in their country and they're looking for a US international partner. So we have to look at their data, what they have so far, and decide if it's an appropriate purchase for us. There's the business people, they make their business input, and then I'm giving them the medical input. Sometimes it's well within my wheelhouse because of my 15 years of clinical practice, but this one actually in particular is really adjacent to what I did clinically. So I'm having to do a lot of research and engage some clinicians that are experts in that area of medicine because I'm not the expert in this particular therapeutic state. So it's taking a lot of research and knowing all the competitors. And that's really true of everything that I said so far. The last thing that I'll do that is, I think, different than some medical science liaisons, which you may hear about in some portions of this talk that I'm not giving you, is I'll deal with our market access team and some of the national payer accounts. So market access and payers are things like the insurance companies, United and Capital Blue Cross and, pharmacy benefit managers. And, when I used to be in clinical practice and I'd write a prescription and a therapy was, easy to get, or if it was, you need a prior authorization or was tier 3 or tier 2, pharmaceutical companies are meeting with these different payers, what we'll call our market access team, in order to try to make sure clinicians and patients have appropriate access to medications. And their medical directors, the medical directors for these payer teams, right? United, Railroad Workers Union, I'm trying to think of big payers, will want to meet with a medical director and have a medical presentation. So sometimes I will get involved with that as well. Some of the other differences from a medical director versus a medical science liaison is I do travel less. I do have to travel some, but it is often more self-directed that I can choose the conferences that I want to go to. I do have a little more internal company meetings that I have to go to. I'm not based in the home office. I'm luckily based in my home. I would say most medical directors are based in the home office, but about 25% of medical directors do get to work remotely, but the bulk, like 75%, will work in the home office. I am based in my home office, as you can see behind me. So I do have to travel to internal company meetings periodically, but I still travel less than I did as a medical science liaison. So that actually brings me to the topic of how I got this job. So I practiced for a little over 15 years as a physician assistant, loved being a physician assistant, great profession. If I was, going back in time, would I become a PA again? And my answer is yes. And then I had the opportunity to become a medical science liaison, which we could tell that story another time. But I love being an MSL. I think that's a great job. I love the different roles of an MSL. Really was very happy being an MSL. Thought maybe medical director, but years from now, really happy being an MSL, and then became a senior MSL as I was training some of the newer members of my MSL team, including some physicians and some pharmacists that came onto the team, and I trained and oriented them. And then all of a sudden, one of our medical directors left very suddenly, and there was an emergent vacancy for one of our more complicated medications. And my VP of medical affairs asked me if I would fill in temporarily while the company conducted a search for a physician medical director to fill the role while I did my day job as an MSL. And I said, yes, of course, this medication needed a medical director. It was newly launched and a complicated injectable therapy. And I said, yes, I'm honored that you would ask me. There were other senior members of my medical affairs MSL team, some of which were physicians that wanted a medical director role. And my VP asked me. And so I said, yes, this is, great opportunity. This is amazing. But if I do a good job, would you consider me as a candidate, a permanent candidate for the medical director position, right? If I can do it for a couple months, would you consider me for the role? And she said, would you want it? And I said, well, if you're asking me to fill in, right, instead of these other people, you must think I'm capable. So yeah, I would want it. And I'm a single mom. So the idea of a little less travel and self-directed travel did appeal to me, just lifestyle wise. So they had never had a non-doctorate, really non-physician. They have some pharmacists at this company. That was it. So it was doctorate level pharmacists and physicians for the most part, medical directors. And she said, okay, let's consider it. Quickly enrolled in a PhD program. I'm still not done. I'm doing it really, really slowly, but I'm in a PhD program. So I started a PhD program at the same time as doing doing my MSL duties, although they did kind of lighten up on me. And then really quickly on the job, learning to be a medical director. And then after a couple months into it, they did offer me the position permanently. So again, like any good PA, I just learned on the job and busted my butt. So that's right. That's what all of us do. That's what PA school was about, right? PA school was like trying to drink out of a fire hose, right? Learning to show other people the skill set that we have as PAs, right? To get through PA school, to adapt our style to supervising physicians, for example, needs to be explained. That's not intuitive. That the fact that, right, I learned how to drink from a fire hydrant of knowledge during PA school could be applied to being dropped into a medical director role and quickly picking it up and being able to do really well is, to me, actually a quality of a physician assistant. And so if you are watching this now and you're thinking, well, I want to be an MSL, or I want to be a medical director, or there's lots of other roles in the pharmaceutical industry that would be great for PAs that I don't see PAs in yet. And I meet all these colleagues within my company, within other pharmaceutical companies. And I think, oh, a PA could do that. And they don't necessarily look at us because we don't have, MD or DO or PharmD at the end of our name. Learning how to remember all these amazing things that we have in our educational background, in our inherent tool set as PAs, and how to explain that and capitalize on it is going to be one of the best ways to get a PA or medical director or other pharmaceutical industry job if that interests you. So that it wasn't even the question at hand, but I feel obviously super passionate about seeing more of my colleagues in these roles in everyday industry, because it's been a great experience for me. It's been super stimulating. I love it. It's been great work-life balance every day. I absolutely love going to work. I have the best boss of my whole entire life. And I had a lot of supervising positions. And I have to say, this is literally the best boss of my entire life, and really the best culture, best team to absolutely work for. So I hope that this helped give you some answers. There's obviously a lot of detail, so it's hard to cover in a short amount of time, but I hope this helped. Bye.
Hi everybody, my name is Michelle Lim, and I am a physician assistant who works as an MSL, better known as a medical science liaison. I've been a PA for 23 years, but have worked as an MSL for the past almost 8 years, and it is the best job that I've ever had. So if you're not familiar with the role of an MSL, what it is I am a field extension of the Medical Affairs Division of a pharmaceutical company. You can also find MSLs working with medical devices as well. And my responsibilities are scientific education and scientific engagement with those that are treating the diseases that I support. So this could be physicians, APPs, pharmacists, dietitians, nurses, could be respiratory therapists. It just depends on what disease state you're working in. Currently, I work in GI, so I'm trying to meet with gastroenterologists. I support also an EOE program, so eosinophilic esophagitis, so I'm also trying to meet with allergists and providers that work in the allergy and immunology realm. Now, an MSL is completely separate from the sales and marketing side, so when you think of a drug rep, those people are in charge of promoting the sale or the prescriptions of whatever drug the company has. But I am completely separate and operate completely independently of our sales and marketing colleagues. In fact, it's against pharma code for medical affairs people to be doing joint meetings with sales colleagues. So my main functions are supporting clinical trial sites, and this could be company-sponsored trials. It could also be investigator-initiated trials. It could be from all phases of the trials for drug development, so early clinical trials to phase 1, 2, 3, to even post-marketing studies. I also attend a lot of medical conferences because I'm trying to listen for medical insights regarding the diseases, our drug, the competitors, treatment guidelines. I also give a lot of presentations on our data, on the guidelines. I will do this with one-on-one or up to an audience of 100 plus. It just depends. And I also have one-on-one meetings in the geography that I cover. Currently, I cover 5 states, but because of COVID, I'm not actually traveling too much. I'm doing a lot of virtual meetings. But in those meetings, I'm trying to ascertain the provider's thoughts on our drugs versus competitors, our data, safety and efficacy-wise, as well as data gaps. Are there areas of research that they wish they had, or areas of knowledge, or areas of education, or areas of data that they wish they had on the disease state, or on our drug, or on competitors? And then I in turn take these insights back to the company, and this can help form our medical strategy and help us identify perhaps areas of future research, or areas where we could improve our education on the drug or where it fits into the treatment algorithm. To be good at this job, you need to have great communication skills, both written and orally. You have to be able to build relationships. You have to be able to think outside the box and really try to engage with providers that you've never known, providers that are often so busy and have their attention divided amongst all their patient duties as well as all the other MSLs that are trying to call on them. Because really, I only try to meet with the top thought leaders, those that are seen by other providers as the expert in those disease states. So my advice to someone that wants to become an MSL is to network all that you can. LinkedIn is a huge platform for medical affairs jobs. So if you're not on LinkedIn, you should get on LinkedIn and make a robust profile. You should have your picture on your profile because they say that gets more attention or more looks if you actually have your picture on there. And if you work currently in a specialty, that would be your best low-hanging fruit, is to go for a medical affairs job in that specialty because you have expertise, clinical expertise in that specialty. If you publish papers, that's a good thing. If you've given lectures, even if it's just to patients or just pure disease state education lectures, those are all great skill set to have for this type of job. And just hang in there and be patient. It took me many, many years to get my first MSL job because I don't even have a master's, let alone a doctorate. I went to PA school so long ago that only 2 or 3 programs at the time gave masters. So it took me many, many years to get my first MSL job. And I just kept networking, I just kept applying, and just trying to improve my professional skills, my communication skills, and just, reach out to everyone you know. If you currently see drug reps in your office and you're interested in doing something like what I do, tell them that, because they'll often know when there's going to be openings and they could refer you in, or they might know somebody. And I think that's probably the best recommendations that I have. I get a lot of reach outs from APPs every week on this job. And it's so much to the point that I wrote an article on Courtney's Empowered PA's blog. So if you haven't read it, please look for it on the blog. It should answer all of the questions that you have. And like I said, my best advice to you is just to keep networking, be persistent, don't give up, and good luck.